Hi there, my name's Angus Forbes. I'm a professor of diabetes nursing at King's College London, and I have the pleasure of chairing one of the European Diabetes Forum working groups, which are looking at important key issues in diabetes across Europe. And the topic that our group are focusing on is integration. In the group, we have a mixture of health professionals, patient organizations, and people working in supportive industries around diabetes. So we have hopefully quite a representative group of people thinking about this. So integration is our topic, and it's something which has been much talked about in many health contexts, but in particular in relation to diabetes over many years. And so far, we haven't really yet cracked how to make sure that services are fully integrated around the way that we deliver care. So why is integration important? Well, it's important in many ways. Firstly, and probably most crucially, in respect to the patient experience. Patients like to feel that they're in a service which is seamless, which is giving them an experience, which is engaging with them and enabling them to then go and do the self-management, which is fundamental to diabetes. And these then, obviously then link to the outcomes that we see in patients. So we hopefully see improved clinical outcomes on the back of that. And if we're more efficient with the limited resources that we have, then we can actually invest and make our services more strategic and responsive. And in a nutshell, that is what integration is about. So in this forum, we've been exploring what are some of the key constructs that actually underpin this and how we can actually make sure that what we can advise on from our work is going to be hopefully connective and useful to healthcare organizations and others involved in commissioning and running diabetes services. So here are some examples of what we think are important. First of all, some tools or some strategies for you to be able to analyze and assess, where you might have opportunities to enhance integration at the patient, the health professionals, and at the service or the system level within your organization. So how do I know whether my organization, is well integrated or whether there are integrational deficits that I can address? That's one thing. We're also looking at current best examples or good examples of practice. Now, we appreciate something that works well in one area may not work well somewhere else. So what we want to do from that work is to get the key ingredients of those particular models that have worked, so you can look at them and apply them to your setting or your care context to make them work for whatever you have in terms of demand or population of patients. Thirdly, and I think this is really crucial, and this is maybe why integration has not gained so much traction in the past, is how do we make it attractive in terms of the health economics, the resourcing of healthcare. So we're looking at issues of incentives and other things which actually might, help service funders actually see the benefits from them in actually engaging more in the conversations and doing things to improve service integration. And a final example of our work is going to be focusing on educational strategies. And this is particularly for early career diabetes specialists and across the whole range of health professional groups, that they actually learn about the need to consider integration and how to improve systems of care to make them patient-centered and hopefully improve clinical outcomes. So that's just a flavor of what we're doing. I really hope this work's going to be really useful for you all. And I'm looking forward to producing some outputs which will be practical and usable in your day-to-day kind of lives dealing with diabetes wherever you are. Thank you very much for listening.